I would say Integrated Gulf Biosystems or IGB is delighted to be part of the Precision Medicine Expo. IGB, as I said, focuses primarily in the basic research area in genetics and genomics, but now we are moving into the personalized medicine space. Again, the focus was more on rare disorders, but now we are moving into more common diseases like cardiovascular, diabetes, oncology, reproductive health, and so on. So there are two sorts of areas that we focus on. One is meeting customers in this area, trying to understand what are the requirements vary and change from place to place, from lab to lab, and from clinic to clinic. So we are able to capture what are the local requirements of customers, and this is something that requires a lot of ground intelligence. On the other side, we have technology partners like Thermo Fisher and NanoString who have solutions. So we are also able to understand that knowledge, and then we as local partners here bridge the gap. So we bring in technology from advanced technical partners to the requirements of a local clinic or lab. I think there's been more adoption of precision medicine in Saudi Arabia, in the UAE and Qatar to begin with. We also see Kuwait and Oman and Bahrain picking up. The biggest driving influence in the UAE are the intent and the commitment from the rulers of the Emirates itself. Now, just to show one major commitment was that the UAE announced, His Highness announced an Emirates genome program, and he's appointed a board of directors to run this program, where they eventually want every Emirati to be able to receive personalized medicine. The goal is to begin with the Emiratis and then bring it down to every resident. So this board is a combination or combines all the health regulators in the UAE and also leading scientists who are able to put their thoughts together. We probably want to address every stakeholder in the personalized medicine industry, but I think the key players will be two major sections. One is the molecular pathologists and the other clinicians. The clinicians are never going to write a test unless they are educated on what test to write, and once they write a test, the molecular pathologist should be competent to do that test. So we are addressing both these two major stakeholders, but also we are trying to meet the insurance industry, because unless these tests become affordable and covered by insurance, they're never going to become common practice. So we're trying to meet every particular stakeholder in the industry, and the goal is to bring precision medicine affordable and accessible to everybody. In the expo, what we want to do is, of course, to bring in the latest technologies that we have in terms of sequencing, next-gen sequencing, and how is next-gen sequencing helping us in areas of oncology. So especially in blood-based cancers or hematological cancers, we are able to give very advanced solutions of immunotherapy. We're using our immune system. We try to help patients fast. The West has already started this one, and we want to bring these technologies to the Middle East and look forward to early adoption of these technologies across, and that is what we want to use the expo for. We really look forward to seeing all these visitors in the show and hope we can make an impact of bringing the latest technology in genomic medicine that will eventually deliver personalized solutions to patients. Thank you.